Welcome back. Today we're exploring a movement pattern called the deep squat with elevated heels, sometimes informally called the frog position, due to its appearance. This is a variation of the deep squat that emphasizes different aspects of lower body mobility and strength. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before trying new movements, especially if you have knee, hip, or balance concerns. Let me explain what this movement involves and what it may realistically offer. Understanding the movement. The elevated heel deep squat is a squatting position where you lower into a deep squat while keeping your heels lifted off the ground. Your knees are wide, and you may place your hands on the floor or on a support surface for balance. You then rise and lower rhythmically, maintaining the heel elevation throughout. This position requires ankle mobility, hip flexibility, knee stability, balance control, and core engagement. It's important to understand what we're actually working with here. This is a challenging bodyweight movement that combines elements of deep squatting with calf activation and balance training. It's not an ancient secret or a mysterious practice, it's simply a specific variation of squatting that creates particular demands on your lower body. What this movement actually does. Let's discuss what happens in your body during this movement, based on biomechanics and physiology, without exaggeration. First, lower body muscle engagement. When you maintain a deep squat with elevated heels, several muscle groups work simultaneously. Your quadriceps work to control knee position. Your glutes and hip muscles control hip flexion and external rotation. Your calf muscles, particularly the gastrocnemius and soleus, work continuously to maintain heel elevation. Your core muscles stabilize your torso. Your foot intrinsic muscles work to maintain balance on the balls of your feet. This creates what we call integrated muscle activation, multiple muscle groups working together in a coordinated pattern. This is valuable for functional movement patterns. Second, joint range of motion. The position requires significant hip flexion, bringing your thighs close to your torso. It requires ankle plantar flexion as you lift your heels. It involves knee flexion as you lower into the squat. And it requires spinal stability as you maintain torso position. For many people over 50, these ranges of motion have become limited through reduced use. Practicing movements that take joints through larger ranges, when done safely and gradually, can help maintain or improve mobility. Third, balance and proprioception. Maintaining a deep squat on the balls of your feet requires active balance control. Your nervous system must constantly make small adjustments to keep you stable. This trains what's called proprioception, your body's sense of where it is in space. This type of training may support better balance during daily activities. What about circulation? Let's address circulation claims directly and honestly. Does this movement improve circulation? In a general sense, yes, physical activity increases blood flow to working muscles. When your calf muscles contract, they do help pump blood from your lower legs back toward your heart. This is sometimes called the calf pump or muscle pump mechanism. However, we need to be clear about limitations. This movement doesn't detox your body. Your liver and kidneys handle detoxification continuously, and no exercise can replace or enhance this beyond supporting general health. It doesn't target stagnation zones or energy blockages, these aren't recognized physiological concepts. The improvement in circulation is similar to what you'd get from other lower body exercises like walking, regular squats, or calf raises. Regarding the lymphatic system, physical movement in general supports lymphatic flow, which doesn't have its own pump and relies on muscle contractions. However, there's no evidence that this specific position is superior to other forms of movement for lymphatic function. Walking, general exercise, and even gentle stretching support lymphatic flow. Varicose veins, a realistic perspective. Can this movement help with varicose veins or their prevention? The answer is nuanced. Varicose veins occur when vein valves weaken and blood pools in lower leg veins. Exercise that strengthens calf muscles and promotes blood return can be supportive for vein health. The calf muscle activation in this movement could contribute to that. However, varicose vein development and management involves multiple factors including genetics, age, pregnancy history, prolonged standing or sitting, and obesity. Exercise is one supportive factor among many, not a solution on its own. Moreover, for someone who already has significant varicose veins, prolonged squatting might not be ideal, as it could increase pressure in leg veins. Anyone with vein concerns should consult a healthcare provider about appropriate exercises. Organ massage claims, setting the record straight. Some proponents claim that deep squatting provides internal organ massage and supports digestive or hormonal health. Let's address this carefully. When you squat deeply, your abdominal contents do shift position due to changes in intra-abdominal pressure and the folding of your torso. Some people find that squatting feels comfortable for digestion or elimination. This is why squatting toilets exist in many cultures. However, claiming that this movement massages organs or directly influences hormonal balance, prostate health, or pelvic floor function goes beyond current evidence. While pelvic floor muscles are engaged during squatting, specific pelvic floor exercises are more targeted for addressing pelvic floor dysfunction. Any digestive benefits are more likely due to general physical activity, which supports gut motility, rather than anything unique to this specific movement. Who might benefit from this movement? This movement variation might be appropriate for people who already have good mobility and balance, want to challenge their balance and coordination in a new way, are working on ankle mobility and calf strength, enjoy movement variety in their practice, and can safely perform deep squats. Who should approach with caution or avoid? This movement is challenging and potentially risky for many people over 50, particularly those with knee problems or arthritis. The elevated heel squat can increase knee stress, significant balance issues, high fall risk on the balls of your feet, limited ankle mobility. You won't be able to achieve the position safely, hip or lower back concerns, deep squatting may not be appropriate, or previous falls or fear of falling. This position could increase anxiety and risk. For most people over 50, especially those new to exercise or with mobility limitations, there are safer, more accessible alternatives that provide similar or better benefits with lower risk. Better alternatives for most people. If the goals are improving lower body strength, maintaining hip and ankle mobility, supporting circulation and balance training, consider these evidence-based alternatives instead. Standard deep squat with heels flat, all the benefits of deep squatting without the balance challenge of elevated heels. Supported deep squat, hold on to a counter or doorframe while squatting to reduce fall risk. Box squats, squat down to a box or bench at a comfortable height, progressively lowering the height over time. Calf raises, specifically target calf strength and ankle mobility without the complexity of squatting. Glute bridges, strengthen posterior chain muscles safely from a lying position. Balance exercises, practice balance separately using safer progressions like single leg stance with support. These alternatives provide the functional benefits many people seek: strength, mobility, balance, circulation, in more accessible, safer formats. If you still want to try this movement. If you have good baseline mobility and balance and want to explore this movement variation, here's a safer approach. Start with assessment. Can you perform a deep squat with heels flat, feet comfortable, and no knee or hip pain? Can you rise onto the balls of your feet and maintain balance without support? Can you place your hands on a chair seat or sturdy box without excessive forward lean? If yes to all three, you might carefully progress. If no to any, work on the prerequisite movements first. Safe progression approach. Begin with supported practice. Stand facing a counter or sturdy furniture at waist height. Place your hands on the support surface. Slowly lower into a partial squat with heels elevated, maintaining hand support throughout. Hold for just a few seconds, then return to standing. Repeat 3 to 5 times, rest, assess how your body feels. Only progress deeper or reduce support if this feels stable and comfortable over several sessions. Never remove support entirely unless you're very confident in your balance. Key safety points. Keep movements slow and controlled, not bouncing or dynamic. Maintain contact with a support surface unless you're certain of your balance. Stop immediately if you feel sharp pain, significant wobbling, or dizziness. Practice on a non-slip surface, preferably near a corner where you could catch yourself if needed. Realistic expectations. If you practice this movement variation consistently and safely, what might you notice? Within a few weeks, possible improvements include gradually increased ankle mobility and flexibility, improved calf strength and endurance, better balance confidence in similar positions, and increased hip and knee range of motion tolerance. What you should not expect: detoxification effects or lymphatic drainage beyond normal exercise, cure or significant improvement of varicose veins, internal organ massage or hormonal changes, dramatic strength gains. This is a mobility and balance exercise more than a strength builder, or any benefit you couldn't achieve from simpler, safer exercises. The bottom line. The elevated heel deep squat is an advanced movement variation that requires good mobility, balance, and coordination. For most people over 50, especially those with any mobility or balance limitations, it presents more risk than benefit compared to alternative exercises. The claims often made about this movement, detoxification, lymphatic drainage, organ massage, unique circulation benefits, are largely unsupported by evidence and reflect pseudoscientific thinking rather than physiology. If your goals are maintaining strength, mobility, balance, and circulation as you age, you can achieve those goals more safely and effectively with standard deep squats with flat feet, supported squatting variations, targeted calf raises and balance exercises, and general physical activity like walking. Movement is important. Maintaining mobility and strength supports independent, active living. But we don't need to mystify or exaggerate benefits. Simple, sustainable, safe practices performed consistently provide the real value. Thank you for watching. The key takeaway: be skeptical of claims that one unusual movement provides unique, almost magical benefits. Good exercise programming is based on biomechanics, progressive overload, individual assessment, and realistic expectations, not on mystification or pseudoscience. If you have specific mobility or circulation concerns, work with a physical therapist or qualified fitness professional who can assess your individual needs and design an appropriate, safe program. Consider subscribing for evidence-based movement guidance that respects both the capabilities and limitations of the human body as we age. Movement should empower you through knowledge and realistic practice, not through exaggerated claims or risky techniques. Take care of your body with thoughtful, informed choices.